Good morning. I hope you're all doing very well. Today we're going to be talking about workplace-based assessments. Now, this is a very common tool that is used to assess the trainees here in the UK before they progress on to the next year. So naturally, trainees in the UK are very much exposed to this sort of assessments and will know exactly what the question is talking about. But trainees outside the UK will find this topic very difficult as this is not something they get exposed to every day in their clinical practice. So I've summarized it all for you to benefit from. Now this topic is commonly asked about and tested in the exams. So stay tuned. Don't forget to hit the like button and subscribe to the channel if you haven't already. So we have different assessment tools. And the first one we're going to talk about is called a formative OSAT. So a formative workplace-based assessment is an assessment that is looking at the learning of the trainee. So for example, if you were to start learning laparoscopic hysterectomies, and it was your first ever procedure and you did a part of, say you did the uterine pedicles and the infundibulopelvic ligament, so you coagulated that and dissected that, obviously under the supervision of your consultant, of your trainer, but you did parts of the procedure and you've learned obviously something from the procedure. Then in order to show evidence in your portfolio that you are learning the hysterectomy, you will complete a formative assessment. So a formative assessment just highlights learning. So it's a way of giving feedback to the trainee, in a way that's non-judgmental. So the trainee's competence is not being assessed here. So it's not to say that yes, for the trainer to say that yes, the trainee is completely competent and can be signed off for this procedure. It's just to say how well they did in different parts of the procedure and what can they improve on, which is the main thing. So it'll talk about what went well. So the trainee can fill this little box for themselves. So for example, the procedure was completed with no complications, blood loss was minimal, the ureter was identified well, the bowel was kept away. What did you do to keep the bowel away? So for example, the patient's bed was tilted so the head was low, and those kind of things. So you're going to talk about why did it go well, and then you want to talk about what could have gone better. So say if there was some bleeding from the vaginal vault, or if there was some bleeding from the uterine artery pedicle, then maybe next time you want to consider using the bipolar before you use any cutting device, and so forth. So what could have gone better? Then a learning plan. So what are you going to do to try and improvise on what you've already learned? So it could be things like, oh, actually I'll watch YouTube videos on how to perform a hysterectomy, or I'll read up about the procedure. I'll try and do more procedures in order to get more experience. And then the last thing is the trainee reflection. So the trainee gets to reflect on their performance as well. So they can say, oh, actually it was my first procedure, and for my first procedure I thought it went very well because there were no complications, or the timing was really good, my trainer was quite impressed. However, I do think I could improve on X, Y, and Z, and they can talk about that. So it gives a chance for the trainee to look into depth at the procedure performed. So it could be for anything. It could be for cesarean section, it could be for an ovarian cystectomy they did, or anything like that. But it's mainly a form to say in your portfolio that you are learning a specific procedure. Um, then there's also a box for assessor comments. So the assessor could also write up any comments and give feedback to the trainee as well. So it's a very useful, helpful tool for somebody who's learning the procedure to fill out this form and go through it in a stepwise manner. You then have summative OSATs. Now, what does summative? The word summative, so it's a very similar form, but in this form, you are being assessed whether your trainer thinks and you yourself think you are competent to do the procedure, or you're still working towards competence. So say you've been to like a few theatres now, and you've done 3 or 4 laparoscopic hysterectomies, and now you feel like you're at a stage where you're feeling competent about the procedure. You know the steps, you know what to do next, you know how to manage any complications. So in that situation, you will then create a summative OSAT form. So when you create this form, this will judge your competence, whether you can be signed off or not for this procedure. So you'll put yourself as competent because you think you've done well and you've done all the steps very well. And you will talk about those steps, what could have gone better. There's always something that you can point out. It doesn't have to be specific to the procedure. It could be about the consent form. It could be how the theatre was running, whether there was a chaotic environment, there was too much noise, and how you could minimize that, but then only relating to that specific procedure, what happened, and then the learning plan, so whether you're going to carry on doing more procedures and so forth. Now this is a mandatory tool, so we have to fill this out. So if I was to say that I am competent at doing laparoscopic hysterectomies, I need this form to be signed off in my portfolio so that I can show evidence that I have learned this procedure well. So it's a mandatory tool. There is a judgment involved, which means that you're judging the competency. Now, you obviously rank yourself. So as a trainee, you would put yourself as either competent or working towards competence. But your trainer will also have to agree with that. So if they think actually you're still working towards competency, that you do not come across as competent, then they could change that from their end as well. So it's important to be able to put a judgment for yourself, but then your trainer has also got the permission to try to change it if they felt the need to. So this is a form that is now you passed your learning. You're now saying I am happy to do this procedure on my own independently. So whether it's an ectopic pregnancy, a cesarean section, a forceps delivery, perineal suturing, a one-tooth delivery, a laparoscopic hysterectomy, abdominal hysterectomy, various different procedures you will need lots of summatives for. And in the UK, we need at least 3 summative assessments, so 3 summative forms to be signed off. One of these should at least be by a consultant, and that's how you can show your competence. Obviously, the more senior you become, you will only need summatives from consultants, not other trainees. So I hope this is very clear for you. Please do let me know in the comment section that whether I was able to explain this in a clear format to you or not. And if I wasn't, I'm happy to go through this again. Then we have something called the case-based discussion. So this is where you, for example, review a patient on say the maternity assessment unit. You've seen a patient with abdominal pain and you've assessed her. You've conducted an examination on her. You've then went on to review to request investigations. The investigations have come back confirming your differential diagnosis. You've then administered management for that patient. So it could be things like asthma in pregnancy, a patient who's got kidney stones in pregnancy. So you then write about the event. So describe the event. So what was the patient, what was the patient's history all about? What was your analysis? What was your differential? What were you thinking? What were you worried about? What were you not so worried about? What do you think was the most important differential there, and so forth. Then you talk about your learning plan. So you may want to go up and read up about kidney stones in pregnancy or asthma management in pregnancy because you don't know much about it. So that could be your learning plan, and then your additional actions. So you may want to then follow up the patient in a clinic, or try and you may think that there isn't enough information out there of patients to look after themselves. Say with asthma in pregnancy, you may want to create a patient information leaflet about it, so you can write those sort of additional actions in there. Then your assessor gets to comment on your case-based discussion as well, to say how well you did, or is there anything you can improve on, and then you write a reflection about it. So you can say, oh, the patient was very short of breath and you were very scared because you were the only doctor on call on that site. However, you knew how to escalate this and how to get help if required. You were able to administer treatment in a timely manner, and how crucial that administration of treatment in timely manner is, because that's what saves lives. So you can just, it's your own reflection of the actual time in, when you were seeing that patient, and throughout the case, how difficult it was, how easy it was, whether you've seen lots of those cases or not so many, and what did you learn from this case. So that's the kind of things you want to put in your trainee reflection. So it's just about, it's, as the word says, case-based discussion. So there's no competence being judged here. It's just about a case that you're discussing that we see all at the time. A mini-CEX, however, is very similar to a case-based discussion, but as the word says, it's a case-based discussion, the CBD, whereas mini-CEX is you are clinically evaluating someone. So it's when a trainer, a supervisor, a consultant is directly watching you take. So say you took a history and examined the patient, and the consultant is there watching you do these things. So somebody is supervising your history taking, your examination. You then go on to request some investigations, discuss the case with your consultant. That's the kind of thing you want to write in a mini-CEX. So it's very similar to case-based discussion, but it's under supervision. You're being watched as to what you're doing. Now, there's something also called as NOTS, which is non-technical skills for surgeons. So it's things like situational awareness, decision-making, communication, teamwork, leadership. So it allows you to then, because all of us, we could be very good, clinically competent in doing a procedure. So in order to, for example, for us to complete a laparoscopic salpingectomy for an ectopic pregnancy really well, I can't just walk into theatre and start doing that. I need a whole team of people there with me. So I need an anaesthetist, I need theatre practitioners, I need scrub nurses, I need lots of people to help me achieve what I need to achieve. Yeah, I need the patient to consent to me. So there's lots of steps that need to be followed in order to do the procedure. Now, this is what this assessment tool is judging. What is your leadership like? How are you asking? How are you communicating things with your with the rest of your team? What instruments have you asked for? Did you tell them what you were worried about? If you're worried about bleeding because the patient is ruptured ectopic, you need to communicate that to the anaesthetist so they can get, say, the blood cross-matched and ready. So it's all of that kind of things that you need in order to successfully achieve anything in a theatre setting or a labour ward setting, where you are constantly, you've got so many distractions, but how to prioritize your decision making through those distractions in order to achieve safety for the patient, but also to look after your staff. So whether you've got situational awareness, so whether you can actually, you've got an insight into what's going on, and how you're gonna manage your workload and your environment in order to keep everyone safe. So it's kind of assessing those sort of things, and it's again, you get to comment on it as a trainee, and then your assessor, your supervisor, your consultant gets to comment as well to say how well you did and so forth. Then you've got something called the multi-source feedback. So this is like the TO1 and TO2 forms. So TO1 is team observation 1, team observation 2 forms. So team observation 2 form is just a summary of all the TO1s. Now TO1s is a form that you would, so in your training you will at least need to complete 2 sets of TO1 forms in a year. So you will need to send out 10 of these forms, at least 10 of these forms to the various healthcare professionals you work with. So you'd send it to at least 3 consultants in your training. Then you would send it to another, for example, consultant in for example, anesthetic, an anesthetic, because that's where we commonly interact as obstetrician and gynecologist. And then you would need to also send it to your fellow doctors, your juniors, the SHOs you work with. You send it to your nurses, your midwives, your healthcare assistants, your maternity support workers, your theatre scrub practitioners, your theatre nurses, and then if you do interact with gynecology managers, your administrator. So you're going to send out all these feedback forms. Now they get to give you feedback on what sort of a trainee are you. They get to comment on your clinical judgment, on your leadership, on your communication, on how clear you are, how what sort of empathy you show, and your note taking and so forth. So they'll get to comment on various things about you, and once that form is completed, you cannot look at it and see what this person has specifically put, but your supervisor can do so. So if there was a concern, say somebody put that your communication was awful, your trainer could have a look and see who has given you that feedback, and then talk through it in order to try and improvise. So collected forms come all into tier 2, so that you're not individually reviewing all tier 1s. The consultant can just create a tier 2 form, and that's got all relevant feedback in order for you to know how well you're doing in the year, assessed by other healthcare professionals. Now, if there is some really poor tier 1 forms and people have really highlighted concerns on it, then it could sometimes result in an outcome 3, which we'll talk about in detail. But it's a very important tool to allow judgment of how well the trainee is functioning in a multidisciplinary setting. Right, so we come on to the ARCP outcomes. Now you've done all your assessments, you've done your CBDs, your Mini-CEXs, your OSATs, your summative, your formative, your TO1s, you've done all of those. Now you get to be assessed by a panel at your ARCP, which is your annual, sort of appraisal, where they look at all your evidence that you've provided and see whether you are okay to finish the year or whether you need more time. So an outcome 1 means you've got satisfactory progress, you've got everything you need at the required stage and at the required rate, so you're doing all good. Outcome 2 means that you have got some specific competencies that you still need to achieve. However, the panel feels that you don't need additional time for this. And outcome 3 is where there is inadequate progress. So the panel feels that you need additional time in order to finish off the competency that you still lack. Outcome 4 is you've been released from the training program. Outcome 5 is you have incomplete evidence presented. So, for example, you forget to add the teaching log of your teachings, the teachings that you've attended in a year onto your portfolio, or you're missing that. You've got the evidence, they know you've got it. So, for example, if you passed your MRCOG exams but you forget to upload your results onto your portfolio, that kind of a thing, something would give you an outcome 5, that you're missing, you haven't provided all of the evidence. So they'll then give you a little bit of time to upload that evidence and then reconsider your ARCP outcome. Outcome 6 is you have finished your training and you can be awarded CCT, which is completion of training, and that's all that is. And outcome 6 is all what we are aiming for and trying to work towards. Outcome 8 is out of program, so you've got time out of training, so you are on some research year, or you're on a career break and so forth. So your training is sort of paused in that way. And outcome 10 is a special outcome that was created for COVID only. This outcome we're not using anymore in the UK because we're not being judged by the COVID standards anymore. But when COVID was around, we were given outcome 10.1 and 10.2. 10.1 means that your progress is satisfactory. However, some specific competencies have been missed out, but that's because of delay because of COVID-19. 10.2 is your progress is satisfactory. However, you are at a critical point in your training and you would have needed the specific competence in order to progress, and you haven't got that. So you actually do need some additional time. So 10.1, you don't need additional time. 10.2, you do need additional time. Well, that's it. That's all the different forms of assessments that we use here in the UK. I hope that makes it really clear for you. Do write in the comments section if I've been able to clarify this topic for you, and if you would need some further clarification, I don't mind going through any extra bits in this if you needed me to. This topic is commonly assessed in the MRCOG exams, so do make sure that you understand this very well. Thanks for listening.